So we're going to go through some of the points about hypertension related to ophthalmology. You should also watch the video on diabetes in ophthalmology for some of the explanation. For hypertension, you may immediately think about the chronic hypertensive change and the 4 grades. They aren't the most alarming sign in ophthalmologist practice, however. For practical purpose, you may also want to know about accelerated hypertension and hypertensive complication. In fact, hypertension can lead to retinopathy and choroidopathy. I'm sure you're familiar with this grading from internal medicine, but you may find it difficult to remember. To make it simple, grade 1 is vasoconstriction, grade 2 is about small vessel changes, that's the AV nipping and silver wiring or copper wiring. Grade 3 is leakage, grade 4 is grade 3 plus optic disc swelling because of malignant hypertension. So grade 1 is the vessel response to systemic hypertension by vasoconstriction. The arteriolar attenuation could be generalized or focal. In practice, this is quite difficult to pick up and is less marked in older patients because the vessels are less elastic. For grade 2, because of prolonged damage due to systemic hypertension, the wall of the arterioles become hardened and lost the elasticity. Now on the fundus, you will be able to see the arteries and veins. Basically, the thicker and darker cutted ones are the vein, whereas the narrower, lighter cutted ones are the arteries. They cross each other in the retina, and the arterioles come from the top and have a higher pressure. So when the arteriole becomes less elastic and hardened, it presses on the vein and causes AV nipping. But remember, minor AV change could also occur even without hypertension. Now, when the wall of the arteriole is thickened and sclerosed, it causes more light reflection and during examination, and that's why they appear yellow or white, hence copper or silver wiring. Coming to grade 3, further damage due to hypertension leads to disruption of the inner blood retinal barrier, which increases the vascular permeability. So that could leak out blood and exudate. Dot, blot, and flame shapes are all hemorrhages of different shape. I will explain why they look like that in the videos about diabetes. Remember, just a couple of dot hemorrhages could be normal. When it leaks out proteinaceous content, you get hard exudate, and sometimes with chronic regional edema, you get what we call a macular star. You may also see cotton wool spots, which represent retinal nerve fiber layer infarct. So perhaps it's best to avoid the term soft exudate because they are actually not exudates. If you also see optic disc swelling, then it is grade 4. Now, apart from worrying about the blood pressure, you also have to think about other differential diagnoses of optic disc swelling, such as papillary edema. Accelerated hypertension refers to severe elevated blood pressure, for instance, a systolic blood pressure of more than 200 and diastolic of more than 120. Of course, this is an emergency situation that could lead to headache and end organ damage. The patient may also have ophthalmic symptoms including scotoma, diplopia, photopsia, or even blurred vision. Fundus examination may reveal grade 3 to 4 retinopathy. There could also be choroidopathy, such as Scheiker streaks, ethnic spot, or even serious retinal detachment. Now, these are rare signs. It's just for your interest. For practical purpose, you just need to pick up malignant hypertension. More importantly, you should know more about the eye complications of systemic hypertension. You may not be able to pick them up. However, if you are aware of them, you may be able to make prompt referral. Some of these are visual threatening but treatable. They are macroaneurysm, which could lead to retinal hemorrhage and exudate, non-arteritic anterior ischemic optic neuropathy, the NAION, which could lead to visual loss and visual field defect, retinal vein occlusion, and retinal artery occlusion. They can be central or branch. Just remember CRVO, BRVO, CRAO, and BRAO. We will get to them when you come to the ophthalmology clerkship. It could also lead to oculomotor nerve palsy, as I'm sure you're aware of. You may also want to know other indirect complications. Uncontrolled blood pressure may also adversely affect diabetic retinopathy progression. It is also associated with age-related macular degeneration. These are the references. And this is it. Thank you very much.